Hi, Jessica here. I'm making this video today about HG, Hyperemesis Gravidarum, and what better time to make a video and a blog than while I'm pregnant and emotional. Today has been a rough day, and I spent the last hour bawling my eyes out, and then I thought, why not make a video? Hyperemesis Gravidarum, what is it? So, it is extreme nausea and vomiting in pregnancy. Happens in only 1 to 2% tops of all pregnancies, so it's not common, which means that the general population does not understand it or know what it is. And there is no known cause. Nobody knows what causes it, why some women get it and some don't. I felt more motivated to make this video today because of what's going on currently for me. I've been wanting to get around to doing this video for a while. I'm 18 weeks, and I have been wanting to document my experiences pregnancy with it, but I have not had a whole lot of energy and motivation to do that. But I guess today I got a kick in the pants after bawling my eyes out with some of the news that I'm getting, and I'll get to that. So HG, again, it only affects a very small percentage of women, like 1% of women in pregnancy. And so when I say severe nausea and vomiting, it is not like normal morning sickness in pregnancy. It can easily be confused with that, and I can see where a lot of people would think that when a woman says that she's sick all the time during pregnancy. It's coming to go, well, that's part of it, you know, kind of your initiation into motherhood, but it's not like that. It's so much more severe than that. For me, from my experience, this is my third pregnancy. My first was with my son. I did not have HG. I did not throw up. I didn't have morning sickness. I threw up 1 time, 2 times with him. And I had never heard of it before, did not know what it was. My pregnancy with him went really well for the most part, and then I had a C-section because he was transverse and didn't turn. 12 years later, I got pregnant with my daughter, and I immediately started getting sick. I started getting really nauseous about right around like the 4 or 5 week mark after conception, which is really soon, but typically HG starts to show up between 2 to 5 weeks after conception. So before you even get a positive pregnancy test, HG can be setting in. With her, I just thought that maybe I was having morning sickness and that's all it was. And because my first pregnancy, I hadn't experienced that, I didn't know any different. And so at first for a while, I'd go in and I'd see my midwife and I would say, yeah, I'm throwing up. I'm not really feeling that great. And it didn't take long, more than a couple, I think even just 1 or 2 visits with my midwife, and we pretty much knew that it was hyperemesis. And she had made some suggestions for medication and that I could go to the hospital and things like that, but I decided to just do the Unisom B6 route. That is the first thing that is the go-to for treating HG is Unisom with B6. And if that doesn't work, then you move on from there. Well, with my daughter, I only chose to do Unisom and B6 because I was scared. And I really didn't know what HG was, and I did not take the time to learn about it then because of fear, because of exhaustion, because of anxiety, depression. I just didn't feel well. And so I didn't do a whole lot of homework, which is really not like me, but again, I wasn't feeling like myself. And so I was exhausted. I was on Unisom too. So Unisom is a sleeping medication, and it knocked me out. And for the first 4 months of my pregnancy, I pretty much just slept in my room, in a dark room. My son was 12 and he was in school and capable of doing some things on his own, and I would get up here and there and make dinners and stuff when I could. I thought it was really bad. And I could still get a little bit of food and a little bit of fluid down with her. And I didn't realize the spectrum of HG at that point. But I do know how bad it was. It was bad enough that when the HG stopped for me with her, I started seeing the light at the end of the tunnel around 16 weeks. By 18 weeks, it was completely gone. And then at 18 weeks, I started having a whole other mess of symptoms coming on. Now I have autoimmune stuff, fibromyalgia, but I think that having the HG for the first 4 months of my pregnancy really took its toll with her, and it led into me having other issues and complications later. And so that pregnancy was brutal. It was really, really hard. And so after I had her, I really felt like I did have PTSD, and I was just terrified of getting pregnant again. I knew that my husband and I wanted to have another kid, but I was really scared, and I just kept putting it off. Right before my daughter turned 3, in January this year, we were really talking a lot about getting pregnant again, and I was still just on the fence. We were talking about adoption and other routes of growing our family because I was just so scared. And my husband was too. He saw what I went through with her. And then it came down to it, and I said, okay, you know what? Let's just try. And so I said, you know, there's no guarantee that it can happen, that I'll have hyperemesis again. And so, and then at that point too, I had kind of looked more into hyperemesis because I felt like if I prepared myself, maybe I could try to prevent it from happening again. Only there's no guarantee. And so I just thought, well, this time around, I'll be more knowledgeable going into it so that I understand what I'm dealing with. And so we also came to the agreement that I would, if whatever I needed to get through HG, I would do, because I was scared to do that with my daughter. And that's why I only did the Unisom B6, because as a mom, you're already worried. You know, you start throwing medications into your body when you're pregnant, you're worried about what's going to happen to your baby, even if something is considered generally safe during pregnancy. You just feel like you never know, and you're just risking this poor little baby, right? So with her, I didn't take any other options. This time around, I said, whatever I need to do to survive it, I will do. So when nausea started kicking in, I think it was right before I got my pregnancy test, I started feeling nauseous, and I was like, okay, I know I'm pregnant. And I was hoping, oh, please don't let this be HG again. Just let it be a little morning sickness. And that lasted about like 4 or 5 days. I got my positive tests back for pregnancy, and then I went into a week where I was bleeding a lot and the nausea stopped, and we were worried that I was miscarrying. The nurse for my OB thought I was probably miscarrying, to kind of be mentally ready for that. And that was really hard to go through. But then at the end of the week, we had been testing my HCG levels, and they were going up. And by the end of that week, the bleeding had stopped. The following Monday, just a couple days after getting the good news that everything was going okay with the pregnancy, HG kicked in really hard and really fast. And so I was like 4 weeks at that point. And it didn't take long for me to start getting dehydrated. You want a pouch?
Yes.
It didn't take long for me to get dehydrated and needing to go into the hospital for fluids and doing ER visits, getting on medications. So there are treatments for HG. There's, like I said, you can go in and get hydrated at the hospital or through your OB. For me, I had to go into the ER like 3 times, and then I was put on a PICC line. And I'll show you what that is in a minute. But I was also put on multiple different medications to try and see how it would do. I did do the Unisom B6 thing. It did not help. Not at all. Didn't even touch it. And with insurance, that's the first thing you have to do. It's the first thing that doctors want to see you do before they start going to any other extremes for treating HG. It's always Unisom B6 first. So when that wasn't working at all, and I couldn't hold anything down, then we went to Phenergan and Zofran. And I was really scared to do Zofran. I have heard so many mixed things about Zofran, especially when I was pregnant with my daughter. And I think a lot of that has been cleared up now. There were some things going on in the news and with some pharmaceutical companies with that. I'm not going to get into it. But anyways, it felt scary to take Zofran. And it still does. Any medication really does feel scary to me to take. I'm not big on taking medications and popping pills or anything like that. I like to try to do things as natural and healthy as I can, but in this case, unfortunately, I need all the medical help I can get that's going to alleviate this and help me to get through it. So anyways, the Phenagrin was knocking me out. I was really tired and I could not get out of bed. I could not get off the couch. I could not stop falling asleep. So that was just not going to cut it with a 3-year-old running around this time. So I'm like, okay, I'm just going to have to stick to the Zofran, which reduced the amount of times that I was vomiting, but did not stop the nausea. The nausea is so debilitating. It's like 24 hours. It never, ever stops. It's very traumatic. It's like a torture, really. The nausea just doesn't ever stop. Like puking for me is almost better because it feels like at least if I can just throw up, then I can feel better for a little bit, but the nausea never stops. And this time around with the HG being worse, my aversions were also worse. I couldn't find any safe foods for the first few months being pregnant. For like the first 3 months, I could not find a safe food that I could keep down or that I didn't feel an aversion to, that didn't taste, nothing tastes right with HG. There's just, everything is off. And since the smell is through the roof and, those are some of the normal things with pregnancy too, but with HG, I feel like it's just so much more intense than that. So anyways, after 3 visits to the ER for fluids, I have a PICC line now, and I'll show you what that is if you don't know what a PICC line is, because I hadn't heard of a PICC line before, before I had to get one. And so I'm going to take off the sleeve here. Don't mind my skin, it looks like crap. I have a lot of reactions to the adhesives from the bandages for it. But this is what it looks like. So it's a tube. It's kind of like when you have an IV go in, but it's like 18 to 24 inches. So it goes, you have your fluids that you hook here from your hydration bags, and it goes to this tube. And this tube is like 20 or 18 to 24 inches. So it goes up my arm and then it goes down towards your heart. It doesn't go into your heart, but it goes up the arm and then down towards into the heart. So yes, these are not, nobody wants this. And there are, when things are going well with it, it goes great. For some people, though, it can be really scary because you can get clots and infections with them. They cannot get wet. And so I have to get creative when I take showers, which are limited because of my anxiety. I fear getting it wet. So I do a lot more just washcloths and scrub downs and then showers like once a week. And when we do that, I am wrapping it in cling wrap, and then I'm putting a bread bag over it with waterproof tape, and I'm just trying to keep everything as dry as possible. So far that has worked really well. But so since I'm on that topic, the reason why I started just feeling like making this video today is because of my PICC line and what's happening with that. So today is September 17th, Tuesday. Last Friday, I saw my OB for a regular checkup, and she said that it's time for the PICC line to come out. And I was really surprised to hear her say that, because in the HG support groups that I'm in Facebook, which I am so grateful for, because women there, they're going through it, they understand it, and that's just worth its weight in gold, because the general population does not get this illness. But anyways, a lot of women who have PICC lines usually often stay on them for their whole pregnancy. They switch arms, but some doctors feel like that they need to come out after a certain amount of time. So this is my 8th week with my PICC line, and my doctor is very hesitant about me having it in any longer. She's concerned about liability and the risk of infection and clotting going up the longer that I have it in. I completely 100% understand that, and I understand the risks that come along with having a PICC line in. However, I have not had any problems with this PICC line, and my husband and I are doing everything possible to keep good care of it, and I have great home health care every week that comes to my home to help me do dressing changes, and I get weekly deliveries of all my medications and vitamins and fluid bags. So everything's been really kept up on, but she is worried about the liability of infection and clotting, because that can be extremely serious if that were to happen. The other part, though, that was frustrating to me on Friday is when she said to me that she was concerned that maybe I just need to try harder to get fluids down on my own so that we could stop bypassing my gut with the PICC line. And that's the hard part. A lot of women with HG are told that they need to try harder. Nobody wants HG. Nobody wants a PICC line. Nobody. Okay, and there is nobody with this illness that would even wish it on their worst enemy. It's that bad. So, you know, I tried to explain to her and talk with her that the one thing that helps me is having my PICC line and having the hydration, because if you ask me or pretty much any other woman with HG, one of the top things that helps them to feel better is hydration. If you're not hydrated, you start getting dehydrated, the worse you get. And so she's basically like, you need to get like 2 liters of fluid down in a day. And I'm like, I can barely get down a few sips of fluid in a day. And I'm talking sips like less than 6 ounces in a day on a good day. And so anyhow, she's adamant about it coming out. And that was really hard news to get on Friday. So I knew it was coming. And she told me to stop the hydration bags. So Friday, Saturday, Sunday, and most of Monday, yesterday, I did not have fluid. I didn't have hydration bags, and I was throwing up a ton. Could not keep my food down, could not keep any fluid down, and I lost 5 pounds. So weight loss is definitely an indicator of HG in pregnancy. When you're losing 5 to 10 pounds or more during your pregnancy weight. And so Monday night I gave in, and I had my husband hook me up to a couple hydration bags. My 15-year-old son knows how to help me with that too. So anyways, hooked up to a couple hydration bags, and I was feeling a little bit better this morning. Still really sick, because usually when I've gone a few days without fluids, it takes me a good few days plus some to start really feeling better. But I haven't thrown up in 24 hours now. Okay. I got a call today from the coordinator for the nurses for the home health care services that I'm on. And she said, hey, it's time for that PICC line to come out. And I said, yep, I know. And so she said, well, what's your schedule like? And then before I answered her, she said, tomorrow is really booked for me. And I said, okay, why don't we schedule it for Thursday or Friday? My last dressing change was last Friday. So why don't we just do Thursday or Friday this week? To have the PICC line taken out. I said, besides, then I'll be able to do a couple more nights of hydration bags. And she said, oh no, your doctor wants it out, and you're not supposed to be doing that. And I said, I know, but I have a bunch of supplies still. We're paying for them, and I need them. And if I have 2 more days of getting hydration, then it's not going to do any harm. And if you're busy tomorrow and you're booked tomorrow, then why not just schedule me for Thursday? Okay, we're talking a day away. Big deal, right? And she said, look, we cannot push this out. You're trying to push it out. Your doctor wants it out. So I will find somebody to come to your place tonight. I'll find an on-call nurse somewhere. I felt like I was about this big, like I had been scolded. And I immediately had to remind myself that she just doesn't understand what I'm dealing with, and she has to do what the doctor tells her to do. However, I was confused about her asking me what my schedule was, if that was how adamant she was going to be about it. Doesn't matter. So we hang up, well, before we hung up, she tried to like reason with me, like, you need to have it out because your doctor's worried about it getting infected. I said, I know. And I said, I really don't mind if you want to do it Thursday. We don't have to rush anything. And she was just like, wow, you're really trying to take advantage of this. And it's like, I'm just not in a hurry to get it out. So, anyways, she couldn't find somebody to come out tonight. So there'll be a nurse here tomorrow morning, first thing in the morning, to pull up my IV or my PICC line. And I started bawling the second before I even hung up. I said bye, and the tears were already flooding down my face because I feel like I'm losing a lifeline right now. I get so much worse without my hydration. And Zofran barely scratches the surface for me, so knowing that my PICC line is coming out tomorrow and what's coming is really hard. This is a lot of anxiety, and it just brings on this weight of feeling kind of hopeless because, with HG, you already feel like you don't have any control over your body. And then when you get to the point that you need a PICC line, at least you're getting some help and it's relief. You start to feel a little bit normal and a little bit more like yourself. And then the doctor says it's time for it to come out, even though you're not better. It's really hard to feel like you just don't have any control or any say over what's happening to your body. So, and knowing how sick I'm going to be again. And the only other alternative is just to keep going back to the ER for IVs, or to my OB office for IVs. It's hard. So, losing my train of thought because I'm getting emotional. I really lost my train of thought for a minute. I guess I'll go back to just kind of talking a little bit about HG. So with HG, there is no guarantee about, who gets it. It doesn't matter on your age or the gender of the baby. If you have it one time, if you'll get it again or not. Some of them do, some don't. Sometimes you can have it once and then it comes back worse. That's what happened with me. There are women that get to the point that are worse than I am, that they are on feeding tubes. They're hospitalized. I feel like there is stigma around HG. It's not understood, and I think it was up until the 90s that HG was even taught to most doctors and midwives that it was psychological, that it was all in women's heads. And that's pretty common if you look at pretty much any illness that a woman deals with. For multiple decades, generations, it's told that it's all in their head until something comes along and says, oh, this is real. And that's what happened with HG. I think what stirred the pot back in the 90s, I think it was the last time somebody died from HG, if I remember right from what I was reading. And I don't think there's been any deaths from HG since then. But there are still doctors, there are still providers, still midwives that believe that it's all in a woman's head, that they just need to try harder. Some of these people believe that it's associated with people who have depression. But I will tell you right now that there are plenty of women who are healthy women going into pregnancy that get HG. Depression is a byproduct of this illness. The anxiety and depression that come with it is because of the massive fatigue of HG, the exhaustion, the malnutrition. Some women, physical stuff that happens. You can lose your teeth. They can get damaged. Right now, I'm going into the dentist here pretty soon because of my teeth are getting damaged from all the throwing up. And I don't know what's going to happen, if they're going to do some work or if we're going to have to have some teeth pulled. I'm not sure what's coming with that, but they're not. I have a couple that are not in good shape, and I'm in a lot of pain with those. Before my PICC line was put in, I was really throwing up a lot, 30 plus times a day. There was a point where it was like every 2 hours, I was counting that I was throwing up like 18 to 20 times every 2 hours. So you get to the point where there's nothing left to throw up besides blood, acid, and bile. And you get raw, it damages your esophagus. Some women crack ribs because they're throwing up so hard. I have thrown up so hard that I've nearly passed out. Literally see stars, just like in the cartoons. Another thing with HG is a lot of people, because they don't understand it, we have this thing that we always say, I'm getting crackered and gingered, because with normal nausea and morning sickness, you can have crackers or ginger and do little things that might help you to overcome that. With HG, there is no remedy that cures it or that really makes it better except for the medical treatments. Not in my case, and not in any case of women that I have heard from with HG. pretty much medically treating it is the only route to go. And I am a huge believer in alternative and holistic health and natural routes, and I just have not found one that works. And I don't like popping pills, but that is the route I've gone, and along with my PICC line. So when you hear of somebody like this who's dealing with severe nausea and vomiting in pregnancy, and it's probably HD, they may not even know if that's what it is. I didn't know the first time around when I had it until my midwife educated me on it a little bit. And we just don't want it to be cracker and ginger. It doesn't work. So it's exhausting for your family too, because you need help. You need a lot of help with HD. You're just tired, and it really just brings you down, and you can't go and cook the way you want to and take care of your family the way you want to, and you need help. Luckily, my 3-year-old has preschool, and so that helps get her out of the house. We've had to cancel vacations and numerous things that we wanted to do because I couldn't get out of the house. There are times when I've been in tears telling my husband I can't take it, I have cabin fever, I need to get out of here, and he hooks up my IV in the car and straps it down, and then he takes me for a ride, and I still end up puking, but at least I got out for a ride. And so you give up a lot when you're dealing with this illness. There are times when the nausea and vomiting are so bad that not only do you have problems with like your esophagus or teeth, you lose control of other bodily functions. You pee yourself. Sometimes you have bowel movements while you're throwing out, and it's just a mess. And you don't feel any, like less human, I guess, when you're in those situations, when you're in those times and facing that. There's been a lot of times where, I've been out and I have to leave somewhere because I threw up and I peed myself and I didn't bring a change of clothes. It's like, as a mom, we don't think to bring changes of clothes for ourselves. We do for our kids. It's embarrassing. So you deal with that. There are times I have called my husband. I mean, the side effects from Zofran, with the migraines and the severe constipation, for the first 4 weeks that I was on Zofran, I didn't have a bowel movement. I ended up in the ER. I was in massive pain and totally dehydrated. And, there are things you end up talking about with people that you didn't think you would talk about before, such as your bowel movements. But anyways, then there's things that people say to you. So it's not just that some doctors aren't, it seems like a lot of doctors, really, just from what I've gathered reading in the groups, that there's just so many that still don't understand it or know how to treat it. And then when you find a good one, you really hang on to them, And then just in general with, people that don't understand, sometimes you get comments. Some women don't gain enough weight during pregnancy. They're not gaining a lot of weight, but the baby's doing okay. And they stay really small, so they hear things about that. Some women still gain weight, even with HG. With my daughter, I still gained 60 pounds. It's insane. I was throwing up the first 4 months and really sick, and I was still managing to gain weight. Everybody is different. Every body is different. And that's something that I've learned over the many years of doing health coaching and just my background and training. Every body is different. But there's no time like pregnancy when people feel like you are just open for them to make any comments on your body. So pregnancy in general, women with HG, there's just no need for anybody to make a comment on their body. They're doing the best they can, and everyone carries differently. Everybody is going through different things with pregnancy. And so, and some women, there's a lot of women that are very insecure and very worried because they're not gaining a lot of weight during pregnancy, and that can be hard. There's nothing easy about HG. And so, you hear people, not only is it like, oh, let me cracker and ginger you, but they feel like telling you just got to pick yourself up by the bootstraps. This is just normal pregnancy. Or, yeah, I got sick like that when I was pregnant. They don't understand when you say that I'm sick all the time, that you really can't. You're just really debilitated from HG. And so recently I took my son my 15-year-old, for a job interview. And I felt like it was a little bit of a disorganized situation. But anyways, we took him there. He was there, supposed to be there at 5 o'clock. He came back out to the car at 5:15. He's like, there's a group interview at 6 and we need all the parents to be in the interview. And I was like, what? And I could barely, the job interview was like 3 miles tops from our house, and I could barely get in the car. I had been throwing up. I was having severe pain in my stomach from being constipated. I was just, sweating from all the vomiting, and I just did not want to drive. I was really out of it. And anyways, I took him, and I told him, I said, I can't do this. Please just tell them whatever they need me to sign. Just bring me a paper, and let them know that your mom is sick. I can't do it. And so I was afraid to even get out of the car and walk over to where he was going. He's working on a farm and for fall, and I couldn't do it. I could not get out of the car. So anyways, he comes back with a paper to sign, and he said, you won't believe the lady, Mom. I told her you were really sick and that you're pregnant and you're throwing up, and she laughed and said, yeah, that's normal. We've all been there. And he said, no, she's really sick. Like, she has to have fluid and we have to take care of her, and it's not like that. And even my 15-year-old has seen some of the reactions from people that don't understand it. So for me, I completely expect it, and I don't look poorly on anybody who doesn't understand it. But that's part of why I want to make this video. And so, let's see, I think I've covered pretty much a lot of what I wanted to talk about. I've covered like the ER visits, the medications, just the mental effects of it, what people say, the aversions, some of the side effects of HG just physically. So I think that pretty much sums up a lot of what I wanted to cover in general with all of this. Is basically, if I could just get it through, and you're watching this and you've watched all 30 minutes of it, is that if you know somebody going through this, be supportive, be empathetic. They need it. They really need it, because it's so challenging and it's so draining, and it's already enough to just be pregnant. And when you have HG, you feel like all the joy that you were hoping to feel and the celebration that you were hoping to have with being pregnant is just like this dark cloud over it. I saw the midwife that's working with my OB back at the end of August, and I was talking to her, and she was so caring and so kind. And luckily for me, meeting her and then the two midwives I had with my last pregnancy, they're just so knowledgeable and some of the kindest people that you could ever meet. And I hope that every pregnant woman gets that kind of care and treatment, but unfortunately that is not always the case. I know for me, my first pregnancy was not that way with my OB that I had then. But anyways, I was talking with her, and she was sharing some of her experiences being pregnant and dealing with being sick and having to be on IVs. And that was many years ago for her. And she said, I had asked her, I said, we want to go and do an ultrasound to find out the gender of the baby. And I said, is it safe to go do that? And she gave me the name of some places that she liked, that she had personally went in to go see and find out what their training was. And she said, with HG, you don't get a lot of moments to really feel like you can celebrate being pregnant. And so she said, I definitely encourage you to go do that, if that's something that you want to do and that will bring you and your family some joy. And so we did. I'm not telling anybody the gender yet. But yeah, your pregnancy is overshadowed. And I know that for with my daughter, I was still able to get up and do some things, and there were still some things. I push myself really hard. I'm a pusher, and I'm stubborn, and I'm consider myself to be pretty high-functioning, productive type of person, even through depression or anxiety and dealing with certain things like this. But this time around, it's been a lot harder for me to really be consistent and feel like myself and push through doing anything other than just getting through the day. So that's the most important thing I could just say, is that when somebody is vocal that you know, or a loved one that's close to you, or your spouse that is going through this, the best thing to do is to get educated on what HG is and to be supportive and loving, because they really need it. So, and it's hard on their loved ones too. We know that. We know that having HG is not easy on our family members. Everybody has to pick up the slack, and it's, you know, when mom's down, a lot of times other things go down. So everybody has to kind of pitch in, pull together, and it can be stressful. My 3-year-old has been phenomenal. She blows me away. And I want to share this just because it's so special to me. But when I first started getting sick, it was right before she turned 3. And the first time I started running in the bathroom to throw up, she was right on my heels. Like, would not leave my side, and she immediately intuitively knew to just start rubbing my back, holding my hair back, and I would try to shoo her away and tell her to get out of the bathroom, and I didn't want her to see mommy like that, but she was just like, no. She's just so strong and so nurturing and motherly already, and just intuitively knew, like, I needed to help mom. And then she'd wrap me in a blanket, and she'd bring me toys and want to read me books, and she's just the sweetest little girl, and I'm so blessed to have her in my life. I feel badly that she has seen me so sick. She's been in the hospital seeing me getting poked here at home with nurses, and having IVs put in, PICC lines, and just me going in the bathroom throwing up all the time and not being able to eat. And I know that for her at this little, you know, that can be confusing, but she's still just so strong and so caring, and it blows me away. So, you know, it's hard. You get that mom guilt too when you're dealing with HG. So anyways, I don't want to talk anymore and ramble anymore. This video is far long enough, and I think I've covered enough for right now, and I'll probably cover more in the blog as I write through some things, but just wanted to share my thoughts and vent a little bit and talk about my experiences, because this is really rough. And that's one thing I've learned, is that when you're dealing with an illness, it's better to just not always be quiet about it and be cooped up and alone and isolate yourself, because it can be really easy to do that. And I've done it more than enough. And so there are moments when I really feel like I just need to talk about it and share what's going on with somebody. And I don't know how many people this will reach. Maybe it'll just reach my little small crowd of friends and family, and that's okay. So anyways, I will let it go at that. Thank you so much for watching, and if you have HG, my heart goes out to you. And since I've been through this once, I know it comes to an end, and pretty soon we get to have our little baby in our arms, and HG and all of this just goes in the back of your mind. You get to move forward. Just gotta hang in there. And that's hard to hear all the time. Just gotta hang in there.